I'm a retired obstetrician gynecologist. I've been on the board for about 5 years, I think.
And those are your board members for the board of health.
I think you missed Steve. You missed Steve.
No, I didn't. Steve, I'm sorry. I'm sorry.
It's
Steve.
okay. We dentists are used to being overlooked.
No.
Steve Pritchard, retired dentist, longtime board member. There you go.
Okay, and I'd like to introduce also to you the administrator for the health department, Penny.
Penny Cottle, I've been the administrator since 2008.
And I hear that our health commissioner, Dr. Tom Sharp, is nearby, and I see him there.
He's leaning in here. I'm Dr. Sharp. I've been a health officer for many years.
Dr. Sharp,
Since you were born.
on our budget report, I believe I saw that you were with us 46 years. Is that correct?
Yes.
46?
Wow. I haven't even been an adult for 46 years.
I think it was 45 years. I think.
1976, right?
Yes.
And also, I'd like to introduce to you someone from our legal department for the city or for the county, Margie Rice. Margie?
Hi, Margie Rice, and I have been a municipal attorney for about 20 years, most of that with Monroe County government.
Okay. Well, first on our agenda today is public comment. So if there's anyone that would like to bring an issue to the Board of Health, we always set aside this time at the beginning of our meetings for them to do so. So if you have something you'd like to bring to the attention of the board, please raise your hand on the screen below and we'll recognize you. I don't see any hands raised. Does anybody else? Okay. With no public comment, then we'll move next to the approval of the minutes. These are minutes from June 15th. Has everybody had a chance to review those?
Yes.
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 Any corrections to be made? I certainly didn't find any.
I move they're accepted as written.
I'll second that.
We have a motion and a second. All in favor? We'll do a roll call. Kramer?
I'll abstain. Wasn't here.
Hegeman?
Yes.
Norrell?
Abstain. I was absent. The first meeting that I've missed in my tenure from 8 years, I think.
And we missed you. And Dr. Pritchard?
Yes.
I didn't miss you this time. Dr. Talukian
Yes.
and Dr. Wren.
Yes.
And I also vote yes. So the minutes stand approved as written. Okay, next is public health reports. Penny, you get to go on first.
Sure, I don't have a lot of big updates. We are starting our interviews for those manager positions, so we're excited about that. On the COVID front, our cases are increasing slightly, so we are concerned about that with the Delta variant being in Indiana as well as across the country. I think we're mirroring much of what we're seeing across the country. So people should be aware that the Delta variant is here along with some of the other variants. We have about a little over 56% of our eligible population is now vaccinated. Jamie will talk about, I'm sure, our outreaches. We still continue to schedule those and are happy to continue to do that. In June, the state health department reported 95% of all cases occurred among unvaccinated people, and 97% of all deaths were in unvaccinated people. So even though we do see some breakthrough cases occurring, which is normal, the portion of those among our community is still very, very rare. We are planning in August to have a volunteer recognition. So we are in the planning stages of that now. We want to recognize all of the many volunteers that we had. We had probably, I don't know, maybe 20 to 45 that were really consistent and put in long hours. But we had, overall, we had hundreds of volunteers. So people who came and were at least at the ready if we needed them, or worked a day or two. So we want to recognize all of those volunteers and the many hours that they put into place. So we were planning that in mid-August. And you should have seen in your packet, HealthNet did submit their mid-year summary, and the need is certainly not going down. So as we look at the budgets, we'll want to continue that as well. So I think that that's kind of it in a nutshell, unless you have something specific that you wanted to talk about. Oh, I do want to just, one thing, I turned my head and realized I wanted to make note that we did receive a very nice thank you from the Bloomington Bible Church for our work this year. So that was very nice to get.
Yeah, I have to say that was really uplifting to see that letter from the Bible Church. And it was very, very much appreciated. Sometimes you feel like no one really gives us, understands that we're really trying to help the community, and to be recognized for that. That was very uplifting.
Yes.
Anybody have questions for Penny?
I might ask, have we heard any recent update from the university on the status of, I'm kind of curious with their vaccine mandate, how complete now is their certification process? Have you heard anything about the percentage of students who have either certified or exempted out? Are students pretty well on track with that? Because it could actually have an implication on our end if students are really not on track with that, and they come to town and the university says, sorry, you can't go to your first day of class because you hadn't certified and you haven't exempted out. It might be nice for us to be ready with that knowledge.
Right. And I don't believe that they have all of that data complete yet. We meet weekly with the university, with IU Health, with the county commissioners in the city. So we get regular updates at least once a week. But what they have said so far, the students are still enrolling, so they don't have the complete information, but I believe it should be coming soon.
Yeah, and I hope that students are planning ahead. Some students may just sort of have put that out of their mind, and then they're going to show up here, and then all of a sudden, it's a hurry up for them to get their vaccine, and is there that capability, that capacity? So
yeah, absolutely. So I do know that they have said so far the information looks promising. So I think that they feel like the numbers are good. They are obviously making plans for, and we are working with them on how, for instance, international students who maybe couldn't get vaccinated before they came or returned home or something like that, how we can make sure that those individuals are vaccinated when they get here. So there are plans for that, for those special well, I say special, hopefully they're only special situations, right? That everybody else is vaccinated, but there are definitely plans on how they'll handle that.
Penny, when you say 56% has been vaccinated, you're including IU students in that community.
Yeah, it is based
Because
on our
part of our community, correct?
Yeah, it's based on our population, which does include students. Obviously, any population, fluctuates, and with students, some will leave, some will come, but yes, those numbers are based on our population that includes our students.
Anybody have any further questions?
Is
I
someone
believe-
going to talk about COVID outreach later?
I think Jane is going to talk about it. If
I'll
she
hold
doesn't,
my
I'll-
question for him.
George, you have.
I believe
questions?
IU has a deadline of August 15th for the students to submit certification. So it'll be a little while after that before they have the numbers.
Yeah, I know too that, it's about enrollment. Some of the students, I think, and you all may know this better having come from the university side, but students are still enrolling and submitting all of their documentation is the way that I understand it as well.
Okay, next we have the public health clinic.
And Jama is here, Jama Kelly.
Jana, I think, yeah, I assume that would be you.
Hi, everybody. So here at the Public Health Clinic, we are getting busy again after, what seemed like a very, slow season during COVID, as far as, people coming in for routine immunizations and that kind of thing. We are seeing that pick up again quite a bit. Right now, we're seeing a lot of people come in for TB testing and immunizations for school and for college. So that's nice to see some of that, coming back around and getting kind of back to normal as far as that goes. We are continuing to do COVID vaccines in the clinic on Mondays. We call them Moderna Mondays. So we have a nurse that we've hired just to do that. She comes in and gives Moderna vaccines all day. So people who are interested in getting Moderna can call and schedule an appointment with us on a Monday, and then we get them scheduled to come back in 4 weeks to get a second dose. And that's been going very well. We also have our weekly homebound vaccination visits going on. We have partnered with the city and county fire to do those. So they've had the training to go out to the homes of people who can't get out to get their vaccines. And that process has also been going very well.
Can I interrupt you just for a second there? My question has to do with that. How are people accepting the vaccine when you show up at their door to say you can do it? I mean, what percentage?
We call ahead. So there's a portal that keeps track of people who are homebound, who are in need of COVID vaccines. So they actually have to be kind of reaching out to get the vaccine in order to be on that portal list. And then we contact them ahead of time to make sure that they're going to be available on the day that we're coming out, and around that same, let them know what time about we'll be there.
Okay, so they want to have to get the vaccine first before they can get into the system.
Yeah.
So what are we doing about the people who are reluctant to get vaccines? How do we address them and make efforts to engage them to get vaccines?
Yeah, we're scheduling a lot of outreaches throughout the community. We're trying to target areas that have low vaccination rates, particularly the underserved. So we're trying to do outreaches in just about every corner of the county that we can. And a lot of, we're trying to educate people on the importance of getting vaccinated.
So are you partnering with, what's the name of it? What's them now? Health something or other. What's the name of it?
Yeah.
Health Net. Okay. So are they doing anything to address that issue? Because that's where a lot of these people will actually show up for healthcare, right? Mm-hmm. What's going on with that? And them getting vaccine.
Yeah.
With Health Net, I don't know. Penny, do you know?
Well, we have talked with them, and I know that they are, I believe, testing. They may do vaccine later. Certainly, they are encouraging people, can answer questions for anybody who has questions and wants to get those answers in order to make an appointment, and they can help them do that. I can try to double check while we're in the meeting on what the status of that is.
If you look at vaccine, the reason barriers to vaccines and what you need to do to get vaccine coverage. I mean, we do this in pediatrics. So, I mean, you never miss an opportunity. Missed opportunities is the number one reason for people not getting vaccinated. So we need to make sure we're not missing opportunities so you know, it needs to be in all of our healthcare sites.
Well, that's what I was going to say. The vaccine is now moving. So we're closing down IU Assembly Hall as a mass site because the mass sites, you know, they're not getting the people there at this time. And so vaccinations are moving to providers. So IU Health is getting vaccine out so that providers can, when somebody is there, that point of care, they can vaccinate them right then. They can answer those questions. So that is happening, absolutely.
Good.
We also did receive some additional money, and this is how the additional nurse has come about, but also what I'm going to call a community health worker. That I know that IU Health has a different title, but I can't remember the exact one. But part of their job will be able to go out and talk with individuals, answer questions, kind of gauge. So then we can, let's just say it's a senior housing, maybe they're there one day just to kind of answer questions and talk with people. And then if somebody needs vaccine, then we can go ahead and get them registered and go out and vaccinate them.
It would be more efficient if she had some vaccine in her back pocket she could give right then, though.
Yeah.
I mean,
Well,
that's what I'm talking about. That's what I'm talking about, barriers. I mean,
Right.
they're called missed opportunities, and you can get somebody in the mood for it. Then you had some, they have to call, make an appointment, then they don't do it.
Well, part of the problem with that is the vaccine and how long, if once you open it up, how long it lasts and all of that. So if you don't know, you know, you don't have any idea how many people you're going to see or what you're going to do, that can be problematic. This person won't necessarily be a nurse, so she won't be able to give the vaccinations, but we can go back to them. So it wouldn't necessarily be that they have to show up somewhere. It can be that we can go back, but we would register them. So we would know that we had 5 people in that facility. So it may be part of the homebound program. In my example, if it's senior housing, they could just be part of that homebound program essentially, and we can schedule time. And it could be later that day. It could be the next day. Doesn't necessarily have to be a week away.
Yeah, because if you look, I mean, because if you look at history, we have a lot of historical data about vaccinating children. And you know, and you don't ever want to miss an opportunity to vaccinate somebody. If they say it's okay, you want to get it like right then, because if you tell them they have to do it a different day, it's just gone with, you know, with the wind.
And that's why we take a lot of walk-ins now, as opposed to originally you had to pre-register, and walk-ins. They do take more time because you got to still have to go through the registration process. But
yeah, we've gotten all the low-hanging fruit already, so we got to start looking for the rest of it.
We are. Yeah.
Ashley, you have a question?
I do. Anthony, don't shut that door.
Okay.
I'm sorry. This door locks and he keeps threatening to lock me in. I apologize. It's not very professional. Penny, I was on the state site today and I noticed communities that had mobile units. They said there was a mobile unit deployment.
Oh.
Various counties that were in that. And, you know, it didn't explain to me very well what it was, but I wanted to ask about it and see if that's something, you know, I think about the farmers markets are huge right now. And, you know, there's places, as Carol's been talking to, about getting one. Can you kind of update us on what that is and if that's something that we might get?
We have had it. It is actually the state health department. So the Indiana Department of Health bought, I believe, 8 or 10 mobile units. They're large vans is what they are. So they're not super huge. And essentially they bought one for each preparedness district. The Guard, I believe the National Guard and other staff have been working those. And so each district you can request them, but for the most part, they have been determining where they're going to go based on vaccination rates, those kinds of things. So they were in Harrodsburg. They were in Harrodsburg at the community center in June, and they were back, I think it was last week, to do the second dose. So when they went out, they had Johnson & Johnson and they had Pfizer. So they could do 12 and up. And then they scheduled later to come back and do those second doses. They were also at our county fair for 2 days. So those are the kinds of things that they can do. Farmers market, our nurses staff went to Smithville Farmers Market, very little uptake. Most of the people have said that they were already vaccinated. We were at Juneteenth. So we've done a lot of those kinds of things and continue to do those. We're going, Jama, help me, the 23rd Saturday, is that the Switchyard Park? Okay.
Banneker Center is on the 23rd.
Banneker Center. And then we'll be at the there's an expo at Switchyard Park.
Yep, that's on the 24th.
Okay, so 23rd and 24th, we have outreaches planned there. And every week there's at least one outreach, and that's not just homebound. So there's pretty much something every week that's at least one that's going on.
But outreach isn't the same as like the mobile van, though.
Now, the mobile unit is strictly the Indiana Department of Health.
Okay.
Yeah. I mean, it's an outreach, but yeah. And so every week they list, so you can see if you look at their press release or you go online, you can see where the mobile units are being deployed.
And I saw that, and they are really targeting the most population dense, underserved areas, which, you know, we are not, in the context of Indiana wide, we are not that.
Yeah, we're not the best county, certainly not the best county in terms of our vaccination rate, but we are among the better counties in terms of our vaccination rate.
Anything else, Jama?
Well, yeah, since we were talking about outreaches, I was going to introduce you to one of our new staff members. This is Beth Carpenter.
Hello.
Oh, she's blurred out. Sorry.
That's okay. Hi.
Let me see if I can fix that. Nope.
That's okay.
That's not it.
Nice to meet y'all.
I don't know how to unblur it from here. Anyway, didn't want y'all to have to look at my dirty office or my messy office. It's not dirty, it's just messy. But Beth Carpenter is our new team lead here at the Public Health Clinic, and that has been pretty much her priority since she started working with us, is scheduling outreaches, because we've had a lot of requests for us to come and give vaccines. So we're trying to meet not only those underserved, but even some of those some businesses and certain events that would like to have us there to give vaccines as well. So Beth has been working on that. I've got the outreach list pulled up here in front of me as far as where we've already been and where we have already planned to go, but there's definitely even more than that in the works. We've been to every homeless shelter at least, probably at least twice. Crawford Apartments, Indiana Center for Recovery. We've gone there several times because they get new clients in every so often. So we'll continue to go back there and reach as many as we can. Again, we have Banneker coming up, Children's Expo, Fresh Food Fridays at the Hoosier Hills Food Bank. We're going to do a Primetime Business Expo. Oh, that one's pending. Okay.
Yeah.
And we're doing a
Crestmont.
And
we're doing Redeemer Church.
A Redeemer Church.
Which is for the homeless, basically.
For the homeless. Okay. And is this one still to be determined?
Yeah, that was
okay.
Yeah.
Okay.
So
we have some others in the works as well.
Yeah, and you all went to Mother Hubbard's Cupboard, and you went to the community kitchen, and so it's a long list.
It is. It is. So we've been around and we're going to continue to keep going around. We're also working with schools on providing COVID vaccines in this fall in conjunction with our flu clinics that we typically do. We go to schools and give flu shots. So we're going to offer COVID vaccines to those that are eligible at that time as well. And of course, we work very closely with the schools on the COVID guidelines and help them, make their decisions based on, any cases that they have and any guidance that they need.
Jama, what's the age limit again for the adolescents?
Currently, it's age 12 and over.
Okay, because it was at one time, I thought 16, and it keeps going down. Yeah.
And so they're continuing to look at that, and we anticipate that it might be lowered, even further. But we're just not sure the time frame on that, when that's going to be approved.
Okay, anybody have questions for Jama? Thank you so much.
Thank you.
And welcome, Beth.
Thank you.
Even though maybe next time we'll get to see you.
Let me see if I can.
Okay, next on our agenda is continuing business. Approval of letter of support for the watershed project. And George, I can't see George. Let's see, where is he? Oh, there you are. You're at the very beginning. Thank you so much for working on that letter for us. And we'd like to look at it now. If all the board members, if there's any corrections or any changes you want to see made.
I have one correction. My name is misspelled.
Oh.
My first name. It's Stephen with a PH.
Uh-oh, sorry about that.
It's all right.
There was only one thing I noticed, and it was so minor. When we said we'll provide support in the following ways, we develop, we assist, we provide, and we commitment. Shouldn't we commit?
Yeah.
Anything else? Well, thank you once again to George.
Thank you, George.
Thanks, George.
Could we have a motion then that we accept and would like to send this letter of support?
I'll move we send it as written with the exception of Stephen's name.
Okay.
Thank you.
And the commitment.
Right.
And the commitment. And second, who did you second?
I'll
Steve?
second. I'll second.
Okay.
It.
Okay.
I don't
We
know
have
if
a first and we have a second. Okay, let's do a roll call. Cranner,
Yes.
Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So the letter stands approved and sent. Going to be sent. Okay. Next on our agenda, new business, budget approval. Penny?
Yeah, I'm gonna try to share my screen again and hopefully I can share it and see it at the same time. All right, can you see it?
Yeah.
Yes.
See it
Okay.
better on your screen than I did when I ran it off.
All
Yeah.
right, so I couldn't tell if it was just on, because I'm using two monitors and I can't tell exactly. So it's kind of driving me nuts. So, all right. We got our budget workbooks this last week. We got them on Thursday. So Jamie and I had been working to try to kind of figure out what we wanted and needed to put in here. And then,
Uh-oh. It went away.
did it go away?
It went away.
All right, hold on. Oh no. All right, technically challenged. I apologize. Is it back?
I need to enlarge it at the
You're
top.
capable. Good
There you
job.
There you go.
There you
All
go.
right, there you go. I got two. I'm trying to get my notes where I can read my notes too, so this could be fun. So we got our budget letter from council. As you all know, salaries, those kinds of things are set by county council. So you're not deciding really tonight on what individuals are paid. That's a county council decision. But you are approving whether or not we, ask for these positions, change something. And as always, we're directed to have as flat a budget as possible. But to also this year, if we need something, to put it in there and then let council kind of put it aside if they need to, that kind of thing. So I want to go through this just with all the basics first, and then kind of come back to a couple things that I think may need more discussion, if that's okay. So you'll see on line 22, there's admin assistance where we took out the harm reduction. That's one that I want to come back to. That's kind of an idea. And, we had talked earlier about the vital records. So it's kind of connected to that. But I want to come back to that. And that harm reduction is in a grant by itself, but it originated, it was a split salary. So that's why it's still kind of stuck in there. So don't get too hung up on that.
Hey, Penny, is this a live Excel sheet? Can you actually increase the view a little bit?
Let me,
I'm having a hard time reading
because
that.
I can't see it on my screen there. I can't.
That's view. There you go.
Did that help?
That didn't help. Okay.
Here,
I think
wait
you
a
can read
minute.
it.
Hang on.
I've got some I can see, but I can't. I see the numbers good. I just can't see what the descriptions are. I'll listen.
Okay.
Whoa.
That help?
Oh,
Except it's not all on the
That's too
screen now,
much,
though.
right?
Yeah,
too
you
much.
can't see it all at once.
All right.
Here,
Okay.
try and move my computer a little closer. My eyes, everything's falling apart on me. All right.
Yeah, I
I
tried.
think like at 110 or something.
Yeah, I put it at 125. Let me try. Is that a little bit better?
Yeah, if you
It's
scroll
a little
up.
better, yeah.
Yes, I can read the words and I can change put you guys, I'll just hide you guys. There we go.
Good.
You don't need to see us.
All right. All
No.
right. Well, I'm okay. We'll get through it.
We got it.
So you'll see that the two new manager positions are listed, and those are in here. So that is all set. We did this year, that we have a temporary environmental health specialist position that's kind of covering for a full-time staff person that was deployed. What we've done this year is use their salary to fund that position. With the 2022 budget, what I'm proposing here is that we leave that position in there as a temporary and actually put funds in there in addition to that full-time person. We don't know exactly how long they will be deployed. So we don't know when they will return, number one. When they come back, they'll still have some training to do. They were relatively new. So keeping this in here will allow us to continue some coverage there. We've used this position really to assist in environmental a little bit, but primarily is that extra kind of COVID person to help us with schools, with exemption requests that we had, school plans, answering questions, phone calls, anything that we needed. And obviously we don't know what the fall is going to bring or what the spring might bring. So I think that I know that we can utilize this position. If not with COVID, they can help us kind of catch up on that environmental side. So even if our regular staffer were to return, say in February, I think that we could continue to use this person at least a portion of the year. So I'm proposing that we put a salary in there for them this year for 2022.
Penny, I question the need for more help there. When we met last time, we were talking about the number of septic permits that have really gone up.
Right.
And it sounded like the work had more than doubled. So I question the need for, at the very least, a part-time person there, maybe a.
Yeah. Well, and that's the other part of it, is that if we have that person for 2022, they should be able to either help us catch up, right, in those other areas where we may be behind. And we don't know if that demand will continue or if it will even out. So this gives us an opportunity to evaluate that, to have that additional staff person in there while we do some evaluation of that. So absolutely, you know, it could be that in the 2023 budget, we can make a case for why we need to keep it on a permanent level. So that's kind of where that is my train of thought exactly for that.
I think you can make a really strong case for the fact that, you know, COVID really put a monkey wrench in everything else the health department does. And it's, you know, that you really do need to focus on all the other things the health department does as COVID is relatively under control. So it's all relative. But it's very clear that we've not been able to get things done that would be appropriate for the health department to do. I think you've done everything you needed to get done, but there's certainly things that we should be doing that haven't happened because of all the COVID, and it is time to catch up. And I think you can make a really strong case for that with the commissioners.
Absolutely.
Well, not just catch up, but, you know, I would guess there's going to be another pandemic at some point in the future. It won't be COVID. We need to be ready.
And it's also that COVID could just flare up again. Who knows what's going to happen when all the vaccines start wearing off, and, you know, we don't have our boosters yet or whatever. I mean, we don't know what's going to happen.
There's a saying, let no good crisis go to waste.
Exactly right. We're so understaffed. I mean, you know, compared to what's normal for health departments in the rest of the country, we're so understaffed. We should take any opportunity we can to add employees. I mean, there's always a need. And I mean, like Carol said, there have to be things that we're not doing because we simply don't have the staff to do it.
And is there a reason, Penny, with your thought behind keeping even the part-time line the same? Or is that just because council's asked for flat budgets? Because your part-time line.
Yeah, we have not used all of that. I do want to keep it because we've paid some of those part-time people for COVID hotline were paid out of our part-time line. I certainly would not reduce that.
What about increasing it? Or are you just needing full time?
Yeah, I think it will be hard to make a case to increase it with not spending all of it, right? It is very hard. I don't want to decrease it. The challenge with part-time work is that people come and go. And so it is difficult. You know, it's often students, they're here a little while, they go on. It's hard to get a lot of depth, and it's hard to find people who want to work long-term in a part-time position. And we even, you know, historically, I would say when we have people who come in and want to work part-time, that's what they want to do. Once they get here, they really want full-time work. Whether it's that, wow, the county benefits are good, those kinds of things. But I think that we just see that a lot.
So you've got 38,000, well, almost 39,000 that we've spent last year, right? Where are you at this year, do you think? That 105, my thought was, could we reduce part-time and invest in into the full time.
Well, that is possible. But if we had all of our part-time positions filled all year long, then we would come pretty close to using those funds. But I do think, and that one idea that I want to come back to does kind of address that, and that is one opportunity if we needed to take some part-time funds to help support that we could. Hold on just a second. I'm pulling up the part-time line.
Well, and one reason I like that idea is because I think we've done a good job advocating and increasing staff over the last at least 5 budget seasons. That if we had another outbreak or something, I think it would be so much easier to come back and ask for more part-time dollars from the CARES fund than, and get it from the commissioners rather than trying to get council to give us a full-time, convince them into a full-time position. If we could fund a full-time position, which is, I think is what your idea is up there, right?
It is.
Okay.
Maybe could we come back to that? Penny, if you could talk about the idea,
Sure.
I think that it might be kind of hard to justify, if that's your idea and if that happens, it's going to be hard to justify increasing the part-time line because you'll be taking part-time dollars out and making them full-time. And council may say, why didn't you reduce the part-time?
Yeah, well, my recommendation would be that we leave the part-time, but if we need to reduce something, that would be one option for where we pull it. We had talked a couple of months or meetings about vital records and additional staff, and we kind of looked at other health departments, and we talked about how different all the other health departments are. So some health departments may have 2 people in vital records, but that may be all they do, where our staff are receptionists and they help with our permitting and all these other things. I talked with our registrar and we talked about that local health maintenance position that's part-time. And I talked with our financial manager. We tried to do a little brainstorming. So here's part of our thought. And this has come up even with HR when the administrative assistant position became vacant. So we had someone in that part-time position for many years who came from full-time in vital records, so they knew the health department well. So this is a position that requires a lot of depth. And we have filled that position very, very well. The person is doing great. They're not anticipating being long-term in that part-time position. And I think it will be hard to keep somebody in that part-time position long enough to really learn the depth of what we would like them to do. And that would include filling in and helping vital records when they need help. So we've had that in the past. We don't have it right at this moment. We don't have that capacity. So we could essentially get help for vital records by making the administrative assistant full-time back, and they could spend some of that time to cover vacation or cover conferences, whatever. They could help in vital records as they have in the past. The other potential way to help vital records is with that environmental health, especially that temporary position or one of the other positions, to make sure that they are trained and have the capacity to take money payments for our permits. And so vital records gets help in 2 ways, but they don't necessarily get a person there all the time. The administrative assistant as the financial manager pointed out as well when we were brainstorming, that helps with succession. So as we maybe have new managers or a new administrator, you have the strength and the depth in that administrative assistant position to help with that succession or transition among staff. So the thought was to take that position from part-time, and it is paid out of local health maintenance right now, and make that request for that to be a full-time position.
Out of public health maintenance again?
No, in the health fund is what I'm proposing.
Okay.
Yeah. The job description exists. It really covers everything that we need, except that the job description right now is part-time versus full-time. So we should not have to do a lot of, we may still have to go back to PAC, but we shouldn't have to do a lot of that, a lot of those steps, because we have a job description that we wouldn't necessarily have to change.
Well, I support you in whatever you think you need. I just don't, I also know that the council's going to be having to contend with more positions as always. So,
Any other questions for Penny?
So just a couple of mechanical questions is, did we get the breakout? I don't recall ever seeing a breakout of part-time. Do we get that, Penny?
A breakout.
You know, a detail rather than just everything in one line, all the dollars of part-timers.
No, they put all the dollars in one line.
That seems kind of odd, but whatever. Okay.
I agree.
And then for the full timers, it says 35 hours. What's that about? Is that just like a vacation PTO thing or something, or what?
No, 35 hours is our normal work week.
35 hours.
Mm-hmm.
Right. So that actually kind of exacerbates never mind.
well, we can get 40 hours paid for certain positions. Planning does it. They have several of their staffers work 40-hour weeks rather than 35. Some do 35, some do 40. So that's a possibility, is to give individual positions more hours. The other part with the part-time, just my understanding of it is we don't have job descriptions across county for part-time yet. It's something that they're considering working towards. So each department, Penny's got her lines on her own budget, I'm sure. I know I do, but that's kind of part of it. But I mean, Penny, is that an option, that you have some positions that we could bump up to 40 hours? Let me just complicate this.
Yeah, I mean, it might be a sacred cow at the county that, yep, everybody is 35. That's just the way it is, but maybe it's not.
Mm-hmm.
Well, it's not. We can do 40 on some positions.
Yeah, that definitely could be an ask.
I mean, you know, these are professional positions that you've got here on your list, right? You know, like,
I agree with you, Mark.
It's almost a slap to say, well, you know, you get paid for 35 hours. And they don't punch a clock, and you know they're working more than 40 because they're professional exempt positions.
They're not exempt.
They're not exempt?
No, I am exempt, and the two new manager positions and the financial manager are the only exempt positions.
But there's so much pressure to keep everybody under their overtime. We're not big into giving overtime.
Right, we have to give comp, yeah, and we give comp time, so. Yeah.
Right,
Well,
but they're getting paid competitive hourly wages, but they're only paid for 35 hours.
Yes. Do you have, is 40 hours anything you've ever even thought of for some of your positions that you have, Penny?
Well, it's certain, I can't say that it's not something that I've thought about. I don't, you know, it probably, you could look at that for the manager positions. You could look at it perhaps for those division leads. So those PAT 4s that we have, that could be another opportunity. Or
You might be opening up a can of worms if you do it for some, but not all.
Yep.
Well, but I think that in some departments, our management does have more hours because they're expected, at meetings, and it's the expectation of their position. So, I'm not sure, how much of an issue that is. I know that I've had council members this year ask our department if we were interested in 40-hour work weeks. Penny, did you get the same question?
I have not.
No.
Now, I am meeting with our liaison tomorrow.
Okay. Yeah, like particularly my office, it's just, I guess I could have my people sit around for another hour, but everything's done by 4. So for my office and what it does, and that's one of the beauties about the council giving consideration to departments like planning. That's one of the big ones, Penn, that get and justice, they get paid 40-hour work weeks positions, not all of them, but for that high manager and work expertise and professionalism that you're speaking to, Mark. So, if we don't do that this year, it could be something for us to work towards next year and just secure a position. But, Penny, I honestly think, and then you'd have more of a competitive salary.
Yeah, retention. You're talking about retention for the administrative assistant. Well, gee whiz.
Yeah. She'll have he or she'll have plenty to do. But I do think then you'd be getting closer to the upper, 40s and low 50s in terms of salary opportunities for people. Which is
perhaps we could just sort of put that on the table for future consideration.
Yeah.
And not complicate things now, and maybe start the discussion about, and start the thought process of what's the rationale for, are there certain full-timers on this list that there's a real good rationale for why they need to work extra hours that you could approach maybe next year's budget?
Yeah, I agree with you, Mark.
Well, the other thing about that, and this is where I've thought about it, is when we talk, for instance, we always talk about space, and I always bring it up because we're living in those quarters, right? And that if you don't have space to put additional people, increasing their hours is a way to get those hours without additional people.
And Penny, I might add, a few years ago, I think it was in 2017, the legal department went from a 35-hour to a 40-hour week. And it might not hurt for you to ask Kim Schell if you could have side-by-side budgets to discuss with your liaison. This is what the cost would be if we're 35 versus 40, and then start that conversation. Because now is certainly the time, to think about that.
Okay.
And you're right, that space issue is always a concern, because if you add more people, you have to find a place to put them, and that's more complicated. But I think moving to 40, either for your entire department or for certain positions, and most departments I think have gone, if they've gone to 40, it's like full 40, like the whole department. But certainly I think Kim could probably run a budget for you pretty quickly.
Okay.
It's an easy back of the envelope calculation. It's a 10% increase in full-time salary expense. If you go from 35 to 40, that's, well, roughly 10%, right? 5, yeah. I don't know if I did that right.
So I can definitely ask. That's a great idea, Margie. And certainly, again, asking for 40 could be the easier thing to ask for, and as opposed to additional staff down the road. Okay, any other in terms of the regular personnel that you want to discuss right now? Okay. So board members, I left that the same as last year. So if you want to, I guess, increase your salary, you know, you can do that. The longevity is the annual payment that staff get that's based on their years of service. So that's kind of a set amount. That went down a little bit because we had some turnover, we had some retirement, so we have new staff. We talked about part-time. I would suggest leaving it there. One of the reasons that was also a big increase this last year was because the county set a minimum salary of $14. So the minimum wage at the county is now $14 an hour. So there was a big jump in the budget last year for that. And then self-insurance and all of that, those are set. So that's kind of out of our control. All right. Now, as I go into these other lines, I have to try to look at my notes. So we don't spend a lot in the other automotive. So just kind of other supplies that we might need. Remember, in our local health maintenance budget this year, we had money for 4 new vehicles. We haven't been able to purchase those yet, but those are still planned. So we would anticipate that we wouldn't have a lot of extra repairs or those kinds of things.
Penny, when were we not able to purchase those yet? Was it?
It's availability.
Yeah.
There are a lot of vehicles, but there are no chips in them. So it really is just kind of availability.
I felt like it probably was.
Yeah. So we're working with Greg, our fleet manager, and again, you're going to see in the local health maintenance budget, I put that money in there again, just in case we don't get them or we don't get all of them. That budget actually gets submitted to the state in September. So I can adjust that if we find that it can be lower or something like that. The other supplies, so we did show an increase there. Oh, my notes. We need there were a couple of things that we identified that we needed, a new embosser, some other things like that. So there's a slight increase in that. We kind of looked at what we had been spending and then added a little bit to some of the things staff had indicated that they needed.
Penny, where does the ground penetrating radar for the septic folks come in?
Well, there are some things that are big equipment issues that we actually asked for through the commissioners. And so we are putting that together. We asked for some of those things last year to be in this budget. So we're checking on the status of those things and whether or not we need to re-ask for those.
Thanks.
Now, we could certainly, they really don't give us equipment in here. But if we felt like we wanted to add additional money, or if you wanted to have a side note that if that can't be put in the commissioner's budget, that we would like to add it to ours, that's something we could make a note about and we could do. But yeah, those, okay.
Well, those are capital items, and,
Right.
and they don't go into an expense budget. They
Right.
are depreciated over time. So
Right.
they show up in one depreciation line on the county. So it's not, but it might be nice, just from our board standpoint, to see the list of those items that are put forth.
Hey, Margie, are the commissioners going to be putting forth a bond? When was the last time we did a bond for equipment? Because I'm wondering, why don't we're Monroe County, we don't have personnel, but why don't we buy a medical van? Why don't we get underground sonar? Why don't we, I'm trying to like recall the last bonds that we've gotten, if any of that capital investment went to that department. And
there is conversation about doing another bond. It hasn't been determined for sure that it's going to be done, but I know that the health department could certainly talk to Angie and Jeff Cockrell and put a list together if they wanted things considered in the bond. Again, it'll take the commissioners and the council both to agree upon it. Sure. But certainly this is the time when those lists are getting generated and sent to the commissioner's administrator, and then she talks with the commissioners and they put together a list and go to the council. So I know that's being worked on. If there are certain things that you'd like, certainly it can't hurt to ask.
Okay. Well,
and I've heard that, a bond may or may not be issued. We have a bond rate in place, and we tend to like to continue to do that, about $3 million bond each year to keep that rate in place. But that hasn't been decided for sure.
Yeah, I mean, we could have our own medical van. I think about those things that become a community, use that, and the underground radar stuff George is talking about. I think that's where all like the big goodie lists of, I realize personnel is part of it, but we can also have interlocal agreements when it comes to like a van, that can go around as, Carol was talking earlier. But, all these ideas always come up at budget time, which really isn't the best place for it because we're crunching to get them done and get them over with. But Penny, I would highly encourage you to put together a wish list for capital things, so we don't wind up, missing out, one, or be winding up the county just spending money to, figure out where to spend money. You know what I mean?
And we did submit a large one last year, and that's why I said we'll check with the commissioners and see where those are. I know it's been a crazy year for all of us, so it's hard to just even say, oh yeah, what was that? So if not, then we can resubmit any of those items that are not going to be covered.
Yeah, I'd pull that list back out, Ken.
Yep.
I agree.
Yep. But that's why it isn't in here, is just so you know that those are capital. Fuel.
It's odd that there is automotive and other fairly substantial items, but I guess they are separated out for administrative reasons.
Well, the county has fleet, but and honestly, I can't answer historically, but the department has always used local health maintenance funds to purchase our vehicles. So at some point, there may not be local health maintenance money to do that with, in which case the health department will need to go to the commissioners for those vehicles. But that's kind of, I think, why we've done that, and why that other automotive, it's for, say, I'm going to say tires, $800 ain't going to buy you much in tires, but that's kind of where it's things for your automotive there, supplies.
Thanks.
Yeah. The fuel line, this would be for, the fuel line is for our vehicles. So the vehicles we have that we fill up at the highway garage. So we get billed for that gas. So that's what that is. We didn't, and I'm trying to think why we haven't, even in years prior to 2020, we weren't quite using it. We certainly weren't going to lower it with gas prices going up and potential additional staff. But since we haven't reached that amount, that's why we left it the same here. For medical supplies, that line predominantly was there for, remember we had the DIS and the STD grant in the health fund originally, and that line covered some medical supplies for the DIS. So that is why we've lowered it. I did not want to take it out. There can be some medical supplies that we may need, but there wasn't the same need to have that the same amount. Education and public information, we don't tend to, we have 1 year that we had a lot, and that may have been some transfers actually out of that to cover some other lines. But we don't tend to use all that. So we, you know, people now, they don't pick up brochures, they don't pick up pamphlets, they go online. If you've got them in the office, they take a picture of it, but we just don't use that much money in that line. So we lowered it just a little bit, not a large amount. The environmental health supply line, this would include some radon tests for this next year, in case we don't, typically we get some of those given to us. So they're free, but we wanted to make sure, especially since last year we really didn't do testing like we normally do, that we have those available. And then just wanted to increase that slightly as well, since we'll have some additional staff. Uniforms, we left that the same. I will say this, and I'm going to say this about uniforms, is that something that we may want to give thought to kind of going forward, maybe next year, have a bigger conversation about, do you want to have field staff to have, say, a set amount that they get towards buying their boots, you know, rain gear, whatever kind of gear they may need. If we're going to have staff more cross-trained, for example, and everybody in the environmental section is doing septic, they're going to need some things that they don't need if they're doing other things that don't get them out in that muck and gunk. So that may be something that we want to think about going forward, just kind of maybe giving them a stipend for those things and then letting them get them and be reimbursed. Typically, this is where we buy jackets or a pair of boots if somebody needs them, something like that. Printing and subscriptions, you know, we print business cards, the annual report. We don't print many of them anymore. Subscriptions could be like our NACHO membership, even things like that. So we just left that flat this year. The repairs and that says vehicle, but I have to be honest, it's really repairs on equipment. I think that account line just includes vehicle. We have never used it to repair a vehicle. So if we have equipment that needs some maintenance, then that's where that would come from. The contractual line there is our work study line. So for instance, our SPIA fellowship that we have, that is paid through work study, and that's that line. That's our portion of that. And the official bonds, so we have to have, some of our staff need to be bonded. So we have notaries, they have to have a bond. We had lots of renewals this year. So 425 is pretty much what we have spent, I think, and felt that that was the most appropriate for that. Yeah. We had lots of renewals this year. So hopefully we won't need all that, but just wanted to cover that. Some of those notary expenses have went up. Phones and pagers, that primarily for us is hotspots. So as staff are in the field, maybe doing inspections, doing paperwork, it allows them to connect to the internet when they don't otherwise have that ability. So we left that the same. Travel and training, we increased that a little bit. We have obviously have not used a lot of that in the past year or year and a half, but conferences are coming back. People are back in the field more. Gas is going up. So we increased that by a small amount. We had not quite reached that 18,000. We came close in 2019. So it's a modest increase. And then training and travel, that is the mileage reimbursement that, am I on the right one? No, that was training and travel. Sorry, my eyes are in promotional. This is the line that we added a couple years ago, essentially for public health information, advertising, to really kind of get the word out. We used a lot of movie ads in the past. We've done our hand washing. We've done get vaccinated, those kinds of things. So just keeping that, maybe we're right now looking at some radio ads, maybe using that kind of going forward. I have to say, Bloomington Health Foundation this past year allowed us, they covered all of those radio public service announcements where you heard my voice talking about COVID. That was all from the Bloomington Health Foundation. We did not pay for those, but you know, people heard them. And not that it needs to be me saying them, but definitely people heard those ads. I got lots of comments from people on, oh, I hear you on the radio all the time. So we know that people are listening to some of that. The office lease, and that has to do with our postage meter. We left that the same this year as last. We have a new postage meter. I'm not, because we have a new company, a new lease, I'm not quite sure, you know, we should be set in for that. It shouldn't go up, but I didn't want to lower that. And our cost should be about the same, but I didn't want to risk lowering it at all, just to make sure that things go well this year with that. Postage and freight. So if we buy something, we ship it. Our postage, hopefully our need for postage will go down. We have OpenGov now. We're trying to acclimate to that and get people to apply for their permits online, do those kinds of things, which eventually will cut down on the need for postage, but I don't think we're there yet. Our assessment and our accreditation service related services, we always split funds between those two lines to kind of cover our accreditation activities. And hopefully at some point, maybe in a couple of years, cover the cost of hitting that button and applying for accreditation. In which case we'll need to up those a little bit. But right now I feel comfortable leaving those where they are. The personal health care line, I'm going to come back to that in just a moment, if you don't mind. VaxCare is that is a third party that does third-party vaccination billing for us. So we use that with our immunization clinic. So if someone comes in, they don't qualify for vaccine for children or free vaccine, they have insurance, then that gets submitted to VaxCare and they bill. If we get reimbursement, we get that money sent to the health department. The health department holds this contract or agreement, and then we send 80% of that reimbursement, that returned revenue, to the public health clinic to cover their administration fees. We keep 20% just to cover our administrative portion of managing that. If there are, and there are times where we get a bill instead, then the hospital actually covers that bill with their benefit portion of money. So even if we didn't have VaxCare, if somebody was indigent and they needed that vaccine, then the hospital would use that money as part of their patient benefit. So that should cover everything that we would need to pay out and then some. We don't usually use a lot of that, but again, I never know quite how much money we're going to get reimbursed, and so I don't want to make that too low. The environmental health care, we increased that just a little bit. So this could be lab tests that we send to Dillman. Those lab water tests have gone up in cost, but we haven't been really using all of those funds. Typically, we did use more in 2020. So that's an area, we raised it a slight amount when our financial manager and I went through these, we felt like that was reasonable. And then we have a little bit of room here, whether it's VaxCare or accreditation. If we need a small amount of funds, we can do an in-house transfer to cover those. Refunds, we try to keep that amount small. This past year, we had quite a few refunds because with COVID, if you remember the swimming pools, and we had some refunds there. So we actually spent more money this year than typical. 2020 actual, that $100, that does not look right to me, but I guess it would be 2021. We paid those back in 2021, my error. So I would just leave that as it is. And vehicle maintenance, again, I would leave that flat. So
those vehicles are getting older and older.
Yes, but we're planning to replace 4 of them.
That's true. That's true.
So my hope is that we won't need more, simply because even if we can't get them right away, we'll have them soon, hopefully.
That's out of how many, Penny? How many? 4 out of how many?
We have some pretty new ones. I always have to stop and count. So there's 1, 2, 3 additional ones, and they're all pretty new. The car is older, but the harm reduction van and the preparedness truck are pretty new. And then we have the trailer as well. Yeah. So I definitely picked those older ones and then kind of held back the car. The car is still in pretty good shape, so I don't think we need to think about it yet. So when we go back to what I want to talk about is personal health care.
Which was what line?
That is line 49. I'll try to move it up to the top. How's that? So I am suggesting a slight increase. I think I figured a 2% increase for the public health clinic. And this line covers our contract with the public health clinic for public health nursing, the funds that we give to the Indiana Recovery Alliance for the SSP, for the syringe service program. And then there's generally a small amount of additional funds for other needs that may come across, right? We talked about that before. If there was a big dental need at Health Net, that when it was VEM, was our conversations that they requested that we might have some leeway to do that. So this includes a 2% increase for community health services for the public health clinic. This does not include additional funds for Indiana Recovery Alliance, and that's where you all will want to discuss what you want to do. I don't know what questions you have, but I will share a little bit about why I didn't go ahead and put those in there as a recommendation. So this is the year that we will work on renewing the contract for both the SSP, getting permission to operate it for additional 2 years in 2022 and 2023. And if we want to continue with Indiana Recovery Alliance, which I assume that we do. We'll have to negotiate that contract at the end of this year as well. The request that you received from Indiana Recovery Alliance essentially asked for an additional $100,000. And it noted that we give them, that the health department gives them, I think, $14,005, I think is what they said.
14,500.
Yeah. But the breakdown of the funds that they get through the health department, from our health fund, we give them up to $20,000 and they have been paid full. Each quarter, our staff does kind of a review. Have they met those deliverables? And they have been paid that full amount. So I'm not sure where the 14.5 came from, but we have paid them the 20,000. The Greater Health Foundation of Indianapolis has provided us from the very beginning with anywhere from $5,000 to $25,000 for the SSP. All of those funds have always went directly to Indiana Recovery Alliance for that. Now, sometimes we hold them depending on what the need is. If it is for supplies, then we have, I would say, doled that money out to make sure that there's money all year long for those supplies. This year, it is $25,000. So that is a chunk of change. The harm reduction grant that we get provides for a staff person that's full-time who spends at least 3/4 of their time actively working for the SSP. So doing outreach on the mobile unit in the office, doing data entry for them. The cost for those hours comes up to about $44,530. And then the harm reduction grant also, this isn't a dollar amount that or actual cash we get, but they set aside $10,000 worth of supplies that we can order. And we typically, virtually all of those supplies go to the SSP directly. So all of those things together, if I look at them just dollar by dollar, is $99,530. So they actually do get from the health department or through the health department about $100,000. For that reason, and our financial manager noted that assuming we gave them $14,500, they'd be asking for like a 500% increase. So we have given them a list. We've given them almost a dozen grant ideas for places that they may get additional funding for this. Some grants they have applied for and some they have chosen not to. But it's for those reasons that I did not go ahead and put additional funds over the 20,000 in this budget. If you want to do that, then we certainly can.
Penny, have you been satisfied with the performance of the Alliance?
You know, the staff and the volunteers do really good work. It is probably, in terms of the biggest frustration, comes with, for instance, asking for a detailed budget of what's IRA, what's the SSP, kind of breakdown of what that need is. So we have a good relationship with them, but certainly, you know, the volunteers have dropped, I think, so it's harder for them to operate as well. But in general, yes, and certainly they are the group that does harm reduction. So, you know, we certainly don't have that capacity to do that on our own. I don't know, I have not heard of other entities that wish to do it. Counties can, by code, counties can have multiple entities. They don't have to have just one. So those are possibilities, but I don't know of anyone else who's interested. And I think it's important that we recognize the level of service, the number of participants and people served by the SSP is great. Melanie just reported recently that our return rate is in the 90% range, which is almost unheard of. And I know that you probably hear people complain about, disposed, improperly needles and those kinds of things. But if you can think about what that might look like if we didn't have the SSP, things, I think people would be much more, they would be unhappier than they are now.
Thanks.
Mr. Aber did not, he didn't put a date on his request letter. When did you receive that?
We received that the very end of June, I believe it was. First.
All right.
So for a year though, they're still, I guess I was a little confused by their budget because it says that they still had a net revenue. It was only $3,000, but still it's kind of.
Well, that kind of gets to my point is that there should be a dialogue between the health department and IRA about what happens if you don't get a 400% increase or whatever from a 500% increase. There should be that kind of understanding that we have that says, what are you, Chris, what are you going to do if this big ask that you made can't be done?
Well, I think Chris could spend the money. I think he would report it poorly. And I think that's been kind of the contention, is that like that one sentence really stuck out to me where he said we cannot continue to function as an evidence-based level without increased financial help from the county. I know that's just been a struggle. A lot of it's confidentiality and people not wanting to self-report and things like that. I personally have no objections to giving them the 14.5 we gave them last year.
We gave them 20.
We gave them 12, I have no objections to that. I mean, it's definitely a need. But I'm not a fan of giving them any more. And I would personally like just a detailed report next year on what our 20,000 went to. He can get his $1 million and tell us all kinds of things, but that's not very, his budget's just not very, his statement's not very broken down. But it would be nice to know what our contributions, whether it's financial or it's in kind. Any good grant writer counts in kind, and I know your struggles with getting the reports, but that's where I'm at. I think we still have an addiction issue. I see it every day on my way to work, and their work's important. They're the only ones, and I don't know. That's where I'm at. I say give them the 20,000, and I would personally like Chris or their financial person or whomever to give a summary of where the county's 20,000 and any in kind we give them, where that goes. Like any other grant.
Actually, we kind of have a logistical, a timing issue here too, right? We've got a budget that either needs to green light or not. So I don't, maybe Penny, you could react to this as, what if we sort of want to hear more about this, but we kind of need to get the budget turned in?
Well, certainly. So we'll get to when you meet next. So you could set it at this. Again, we're going to have to be redoing the contract. So there could be a potential. The contract has been 2 years because that's the extension would be, we hope, 2 years. So it could be a matter of, we'll give you 20,000 for 2022, and we would consider increasing it in 2023. That could be a possibility. The other possibility is if we're looking at the health fund to use cash balance and ask for an additional appropriation. If you decided that you wanted to do that during 2022, assuming that there's cash balance to use.
I mean, I like the idea of giving them, you know, continuing to fund them. And then part of that contract is that, you know, we get a little bit more idea at the end of 2022. If we're going to fund them more in 2023 of certain reporting guidelines on that 20,000.
I agree.
I mean, that's all I'm saying. I mean, it's an important job that they're doing, and I don't want to take away their funds, but we can minimize the reporting to us just based on the money that we give them. I don't know.
Well, and again, we do right now, this year, they are set to get in a variety of sources, $100,000 from us.
Yeah.
And there are opportunities for them. This maybe goes to your question, Mark. There are certainly lots of opportunities for them to get additional grant funds if they apply for them.
Yeah.
All right, that's very directly answered. Thank you.
Yes.
So that's the health fund budget. So I guess the big things, sounds like you kind of answered that you're good with the 2% to public health clinic and leaving the SSP the same. I guess the question may be around the administrative assistant, if you want to ask for that to go full-time in the health fund.
Yes.
And, if it gets out of that, if they say no, then we look for other ways perhaps to fund that. And it, whether it's local health maintenance, carryover, or splitting it between those two funds, something like that.
I'm good with that. I think we need to go for the full-time position.
Yeah.
I mean, you can certainly use the help.
I agree.
If a motion is required, I move that a request for the administrative assistant position be made.
I'll second that for full time.
We have a I'm sorry. We have a motion and a second. Let's do a roll count. Cranner,
Yes.
Hegeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren.
You might be on mute.
Yes, I'm unmuted now. Sorry.
And I also vote yes. So the motion carries.
Right. And then do you want to vote for the full budget or all three of them in one fell swoop?
Well, does that include, because I thought you said that it did not include the 20,000 for SSP.
No, it's in there.
It's in there. Okay.
It's in there. I just did not increase it. Yes.
Unless somebody has an objection, I would make a motion that we approve all three.
Okay. So let me go through the last two.
Oh, okay.
Okay.
Well, Penny.
I know. So local health maintenance, 1168, that is tobacco settlement money. We did not propose much of a change. We did reduce the medical supplies a little bit because we haven't used those, and we're using some carryover. So we get $72,672 each year. We have a hefty cash balance at the moment of $489,679. I did leave the $100,000 for the vehicles in here, because if we don't get them purchased this year, I will have to have them in this grant application for next year, and we'll still want to buy them in next year. So that is why I left that the way it is. Oh, yeah.
Is there going to be any kind of funding or lawsuits or anything coming from the menthol decision of banning menthol cigarettes and recovery, like nicotine? And is there going to be any?
Doesn't sound like it, but who knows?
Okay.
You know, always a possibility. Yeah. So this budget, you know, really doesn't change too much. Dropped a little bit, so we'll use a little bit of carryover. The 35,000, Mark, this goes to your point as well. The county clumps it into one. When I submit the local health maintenance fund application to the state, I have to break that out. So it right now includes the part-time administrative assistant. So if that were to go into the health fund as a full-time, then we could submit a different job description, a different part-time position, and put those funds to that. It covers our data entry clerk that we have had conversations about. So we could increase their hours potentially, or increase their salary. One of the challenges with that, this being a grant and the increase in the minimum wage for part-time hourly, is that that's a big jump. So you only have so much money, so they can only work so many hours. So this actually would give us more leeway in terms of increasing their salary, as well as increasing hours. And then we have, which we don't use much anymore, part-time sanitarian. And usually that's what we use for our summer pool program. We haven't used that in the last couple of years, but we could certainly use that position and put more money towards that. So if we get the full-time administrative assistant in the health fund, we can still use these part-time funds. We would just use them maybe in a different way. And that's really the only difference, explanation there, I think. So I tried to use less carryover cash balance. The trust account, so the Indiana Local Health Department trust account, that is what covers our tobacco cessation program and our educator in that program. There's a small amount of money that's paid out of, it's like $1,000 of salary that goes from our preparedness fund for that. And that's just because it was in there. If for the medical reserve corps piece, if we take it out, it can never go back. Since we are using cash balance in this fund and there's less cash balance in here, if local health, if the trust fund account fund went away, we would have enough money to fund this position for 2, maybe 3 years. So trying, you know, I don't want to cost any extra money to be taken from here than we need. So a little bit of a change. They have not been using the money for NRT, the personal health supplies. So I took that out. We work a lot with the hospital. They can supply it. We use the quit line, which supplies it and those kinds of things. So we've not been using that. So that's why I took that out, put a little extra money in training and travel. And the other is for phone, the other supplies. So this would still be using a little bit of our cash balance. We get on an annual basis $54,961.98. So that's it. The
Any
other thing,
questions?
yeah.
What a complete session. Wow.
The only other thing that I might add, and I sometimes forget to do this, I want to ask the council office to make sure we have an emergency fund that has $20,000 of local health maintenance money in it. It was set up several years ago, and it took that TB fund. We used to have an anti-TB fund to pay for TB, if we had somebody, for example, that we needed to house, do extra treatment for, something like that, that we could use those funds. If we had a TB outbreak, right? And those funds were depleted, there's now like $32 of those funds left. And we put $20,000 into there, and it's no longer TB fund. But that could be used for any kind of health emergency that we might have like that. So if we had a mumps outbreak, or let's say measles, if we had a measles outbreak and we needed some cash fast to make some things happen, there would be some money there to do that. We may have to pay it back because it's local, it's this tax settlement money, but it is there for that reason. And I just want to make sure that I think it needs to go to council just so it's appropriated. So it's not a change in the amount or the way it's listed. It's expenses. It's emergency fund expenses. But I think that we do need to ask council to make sure that that money stays appropriated. So I'll just add that as a little caveat.
Having seen all three budgets and being informed about the emergency fund, I move that these all be approved and sent to the council.
I second that, and I admire the work you've done, Penny.
Oh, thank you.
We have a motion and we have a second. Let's do a roll call. Cranner. Cranner,
Unmute.
Mute. Yes, I'm here. Yes. Sorry.
Hageman,
Yes.
Norrell,
Yes.
Richard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I vote yes.
Yay.
Motion approved.
What a great job, Penny. Wow.
Absolutely, especially in a
detail.
short time crunch.
It was a group effort, and poor Jamie is getting all of this by fire, and hopefully though next year we'll be all settled in and she will have been through it once, and we'll be able to
It's no less than I would expect from the Woman of the Year.
yeah.
Yes.
Absolutely.
Good job, group.
Yeah. Thanks. I'll let them know.
Okay, next on our agenda is approval of the 2021 annual report.
Everybody, yeah.
Speaking of group effort,
Yes, so it was late in coming. We normally have it to you by your early April meeting, but we got it done. I'm just thrilled that we managed to get it all done. You should have received the electronic copy of it. We have a couple of them printed just in case somebody needs them. And we make sure that all the staff, that it gets passed around and all the staff read it, sign off that they've read it, so that they get an idea of what their colleagues are doing in their areas. But we did the state survey, which is now meets the requirement in the code for our annual report. That was submitted in June. Thank you, Kate, for doing that. Her and Ben worked with all of our division leads to make sure that all that information was obtained and uploaded, and really grateful for that. And then Kate, again, has been key person in putting all of the individual reports together into one. So.
well, I was impressed with the output.
It's always an impressive, it has been for, I don't know, the past few years, it's been very impressive. The one thing that doesn't really shine through is the huge impact of the pandemic. I mean, it can't, I don't know that it can, right? How do you encapsulate that in an annual report? Like you got plenty of statistical information, but the time and effort in joint meetings with the university and IU Health and et cetera, has just been so burdensome in terms of time, but you just can't reflect it in an annual report.
Yeah, absolutely. Yeah, I can look back and say, man, maybe I should have written a book this past year, but I don't know when I would have.
I don't know when you would have had time
to do that. So,
do I hear a motion regarding the annual report?
I'd like to move acceptance of the annual report.
I'm sorry. What, Carol?
I said I move that we accept our annual report as presented.
And Mark, I think you made a motion also.
Yeah, whoever you want to pick. Okay.
Okay. I'll let you have it, Carol. And Mark, would you like to second?
I second that motion.
Okay, we have a motion and a second. Roll call. Cranner,
Yes.
Hageman,
An enthusiastic yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I vote yes.
Nicely
Okay.
done.
We're down to board member comments. Does anybody have any comments? Penny, I think we wanted to talk about our septic permit.
yes, we have had a septic variance request, and I think Margie has something she wants to say. So we didn't want to have to deal with that tonight. We got that, I think just the end of last week, maybe Thursday. So we didn't feel like we could give it time for prep and then time on top of the budget. So we talked about it if you could meet in early August, maybe the 3rd or the 5th, something like that. And then you could hear the variance at that time. But somewhere in the next couple, early August, if you were to meet and take up the variance. And Margie has something to say.
Yeah, and Ryan and I and Penny have communicated via email. There's a little historical research I need to do on it, and then get a written report to you guys before that meeting. So let's just set the date, and then I'll sort of know to get it to you a little bit ahead of time.
That sounds good. I would also like to get a report from IU about how vaccinations are going, how their preparations for this next semester are going at the next meeting.
And if the cutoff, the deadline is the 15th, according to George, for students to certify or exempt.
And I would like to point out, sorry, my son is just walking in the door, so if you hear the door opening, that's it. I would like to point out, and I don't know, Penny, if you've had any conversations with the university about it, but when I was looking at the IU website on frequently asked questions, it looked to me like there was an exemption that is now allowed, called an ethical exemption to getting the vaccine. Have you heard of that?
I have not heard them speak of that at all.
Okay, so let me see
about it tomorrow, though.
Yeah, let me see. I don't know if the host could let me share my screen. And I will show you what I was looking at. And I just thought if you could find out a little bit about it. So here's my screen, and let's find the thing I was looking at. There it is. Approved exemptions.
There's no explanation, just this ethical objection. What the heck does that mean?
Well, the lawyer in me thinks that's a broad category without an explanation. There's a religious exemption, ethical objection, medical exemption, and medical deferrals.
Do they have to define it, Margie?
Pardon?
Do they have to define it?
No, I mean, in order to sort of know who applies, but it's not even listed as an exemption. It says ethical objection.
Oh, it sure does.
So I don't know what that means, but I noticed it and thought I'd bring it to your attention. And there's still, if you scroll down a little bit, it still has language about, if you have an exemption, you will need to participate in regular mitigation testing, quarantine, blah, blah, blah. Now that's an exemption. Again, that's listed as an objection. So don't know how that's going to work. It's not listed as an exemption. And then it says, they encourage, much of the language is still here the same, that there was some language about, if you don't get it, your classes would be canceled. And your, red card or whatever is going to be deactivated. But I thought I'd bring that to your attention. See, some of you guys have IU connections. Penny, you'll talk to them, and let's see if we can find out a little bit more about it. Because if that is as broad of a category as it sounds like it could be,
I'm almost.
Yeah. If I'm a vegetarian and there's some kind of animal component in the vaccine, does that qualify me to be objectionable to it and therefore exempted?
Right. And
Yeah, I will ask about that. We have meetings with both Kirk White and John Applegate. So I will ask about that. The only thing that I have heard is the religious and the medical. So I'll ask.
How did you find out about that, Margie? That was a great catch.
I am just a nosy little if I weren't a lawyer, I'd be an investigative reporter. And so I just poke around. I was actually looking at the case, the IU case, that opinion, and it made me wonder if they had changed anything on their facts because of the case that just came out. I know that their other side says they're going to appeal it. So I was just poking around, seeing what I could find.
But I didn't see anything I read the whole 101 pages and I didn't see, well, I wasn't reading it with an eye towards that. But great catch.
Well,
I did see most of those.
They weren't going to require, the article at IDS said they weren't going to require proof. Now, we called yesterday, Anthony and I called IU, and they said that the release forms that the students fill out actually allow them to release their medical records. So that's how they're kind of getting around you don't have to provide proof because we're just going to get it from you anyway. So that was kind of my understanding. Is that what you think, Penny? You were kind of nodding your head, but that's what the guy told us.
Yeah, they have the ability to put it in the portal. So they have a place where if they want to provide that proof that they can. I think if you don't, and I don't want to speak for IU, if you don't, then you may be subject to the testing and that kind of thing. So if they don't think,
they have to pay for the tests too.
That's right. And it's expensive.
Yeah, they do.
Oh yeah.
Oh, it just keeps getting muddier. Wow. That was a good catch, Marge. And it's going to be interesting. We'll look for an update from you, Penny, on IU, because I think all of us are interested in what the campus is going to do, especially after the opinion, not necessarily a judgment. And Margie, you too. That'd be great.
From a medical point of view.
Margie, I know you're a really busy lady and you need to do a little research about the septic permit. What time?
Could we wait until around mid-month and maybe fold in the whole IU question? Or is he looking for a variance on a sooner time frame?
Well, I won't be here from July 31st to August 6th. I'm out of the country. First trip out of the country since COVID. So
Where are you going?
Amazon?
No, no, actually, I'm going to Mexico, which is probably not the best place to go, but that's where I'm going. I'm only going to spend a little time. I'm going to be out on an island, so it's.
I want to hear how it goes because I have 2 trips scheduled to Mexico this winter, and I don't know if I'm going to go or not.
Yeah, I can be your guinea pig. So there.
That's right. I want to hear how it goes.
Yeah, okay. I have to be tested when I come back,
How do you get
before I
tested?
come back.
Well,
What kind of test do you have to have right now, this week?
Nothing to go.
It varies.
And to
but
get
yeah,
back, what
you
kind of
tested to
tests
get
are there?
back in.
Can it be one of those home the home rapid tests, or does it have to be a PCR test?
Well, all I know is the test was $244 for,
That would be a PCR test.
so that would be a good one, I would think. Yeah.
That's the PCR.
No. Are we done? Where
No,
are we?
we're
You
not.
just gotta set a date after August 6th, because how about August 10th?
August 10th is the second week in August.
Yeah, but not
Good
good for
Tuesday.
me.
10th is
It's
not
not
good?
good for Penny.
Uh,
It's
that
not good for
week-
Penny.
Yeah,
What
we have,
about the 17th?
well, or we could do Thursday, the 12th.
I could do Thursday the 12th.
Could everybody do Thursday, the 12th?
Yes.
We have
Have
a
a
rapid
winner.
commission meeting that day, Ashley.
I'm
It
out of
looks like.
town. I'll be gone on Thursday the 12th.
We're
Was-
back to the 17th. Can you look at the 17th? Does that work for everybody?
No, I'm going to be gone that week. Visiting children.
That whole week?
Mhm.
Okay, so that week is out. That
Well,
puts us down to the 24th. That's a
Here's
long
what I would,
time.
here's what I would say, Kay, is if
We just need.
one of us is gone, I mean, it could be me at the beginning of the month, or maybe we could do it during the week that Bob's, I mean, preferably it would be nice if everybody can hear, but as long as we have a quorum,
Yes.
in the interest of giving this person who's asking for the variance a rapid response, since we've already postponed them, I've just, in the
Let's do the sooner.
spirit
the
of service, maybe we should be earlier than later. And so that's just my 2 cents.
I'm with
I
you.
think that since Bob has not had the great opportunity of having to deal with a septic variance, he should be involved with this.
Oh, it's
A lot of us have done a lot of these, but Bob
Let me
has
throw
never had
this
the
out.
opportunity.
Let me throw this date out. I'm
You're
hearing that
right.
Margie needs more time than the 6th. So
Okay.
how about the 11th?
I can do the 11th.
That's a
I can do
Wednesday.
the 11th.
I can do the 11th.
Does that give you adequate time, Margie?
Yes.
I can't do it because I have another board meeting that night. So, but that's okay. You guys
That's
can do it.
okay. We'll
Can we
be,
do them on Mondays?
We certainly
so you-
could. We could
Maybe.
try.
You play tennis, Steve, you can't do it.
Well, that's not till 7, so surely we'd be finished by then. So
How about Monday, the 9th?
I'm good on Monday night.
I
I
have
can do Monday afternoon.
Only if you promise to sing happy birthday to me.
Oh, definitely.
Oh.
Definitely.
Yep, we could do it the 9th.
All right. Do you know you're not supposed to work on your birthday?
I hate for you to
You
work.
know what? I'm a grown up and that's just what grown ups do sometimes. So
I always did, but
What time would you like this meeting on the 9th?
4:30 as usual?
Okay, I can do that.
4:30 as
Sounds good.
usual. Everybody okay? The 9th? at
Oh,
4:30.
for sing birthday song.
okay.
Okay. I think
got it.
then with that, we are.
On my
adjourned.
calendar.
Thank you.
It was
Thank
nice to
you.
see everybody.
Thank
I
you.
miss you all.
thanks, guys.
Everybody.